Okay, so let's say you do snore and you did go get a sleep study, or you're worried about it. It turns out you do have sleep apnea. What do you do about it? Well, there's a medical way to treat it and a dental way to treat it. Let's start with the medical way. The gold standard for treating sleep apnea is with a CPAP. CPAP stands for Continuous Positive Airway Pressure. It's a pump. It's just an air pump. Nothing more complicated than that. So you wear a mask on your face, and you hook this pump up to it at night, and it's going to force the air in. Whether you want it in or not, it's going in. Now that's a good thing, because as we get air back into your body can start to heal itself. It can go back to normal. The downside to a CPAP is, well, you're hooked up to an air pump. So you've got the noise, you've got the mask, you can only sleep in one direction. The air tends to dry out your nostrils. So it does have some disadvantages to it. But the advantage is that it is going to get air into your body. Well, is there another way you could do it? Sure. It's called surgery. You could get with an ENT or get with your surgeon, and essentially if you've got a problem with that tissue in the back of your throat, your tonsils, your adenoids, the soft palate, if all that's in the way, you can simply have it removed. Now, surgery is something to consider, but we usually use that as a last resort. The problem with surgery is, well, just that, it's a surgery. And they usually break it up into two types. Either just remove the tonsils and adenoids, or they do what's called a UPPP. Now, I'll be honest with you, that surgery can be very traumatic. For a couple of weeks, you're uncomfortable. You are on pain medicine. So I don't recommend this surgery usually unless you're a very severe apneic. Now, of course, the other side of the coin is, if you're in your 50s or 60s and you've already had a couple of heart attacks and you're living on a blood pressure medicine, and you're just having trouble getting through day-to-day life, well, a couple of weeks of being uncomfortable is not the worst thing. So those are your two medical ways of treating it, either a CPAP, which is the gold standard, or going with surgery.